So you all were here with me for the morning presentation, so I won't try to summarize it except to say that I think it was remarkable. And each one of the presenters really was talking about systems perspectives. One of the things we said on the call about Norway is that if your dissemination strategy is training master trainers, it's completely different than training a systems-wide approach for the whole system. And I think we need very much to think about that. And then I think another thing in all of these is a shared vision. I think our vision is to have a comprehensive, inclusive system that covers everyone and gives everyone access to evidence-informed preventions and treatments. I think that's true in Norway. I think it's true in Dick Sposs's work within, I'll say, the 4-H system. It has a much more elegant name. And I think that's very much what Mary Jane is thinking about. In all the presentations, an attention to cultural humility and cultural competence is needed. Interventions typically are devised in one culture and one language, but offered to people in many different languages, many different cultures. We need to understand that process much more fully, and that's been a part of these successful systems-wide approaches. And I think one we haven't talked about a lot today, but figured a great deal in the IOM report, was the need to narrow health disparities. The increasing health disparities, the increasing wealth disparities are driving the poor outcomes in many different situations. And probably the presentation about homelessness, the last keynote, really dealt with one innovative approach to that, but I think that has to be part of our comprehensive work. I would say, as a physician scientist, I don't think we know enough about how to study and learn about the processes of implementation and dissemination in the same way we know how to do randomized trials, and we don't know how to learn from what does, I wouldn't say it's a failure, it's what doesn't go the way we expect, and we have to modify what we're doing. We need to think about cultivating that climate. The IHT folks have done a very good job of that, and I think we need to think about it. And finally, I would say that along with equal access and equity and narrowing disparities, we want to achieve genuine partnerships with families. So when Amy describes a family that the mother learns certain skills and then carries them on years after the intervention has ended, that's a partnership, a respectful partnership among experts. And that's what we want in doing family-based interventions. That's what characterizes, for example, Carolyn Webster Stratton's interventions over time, that these families come together, they learn skills, they're partners with their coaches, their teachers, and then they carry them on. And so I think paying attention to how to develop respectful partnerships is really important, and was certainly a part of all three of the presentations this morning. So thank you.